or rather, good evening, everyone. Yeah, welcome back to a new semester. And this semester, we'll be going more into the nursing core courses. One of them, which is MEDSURG nursing. As you've seen from the curriculum, the MEDSURG is divided into various systems ranging from respiratory disorders, hematological disorders, cardiovascular disorders, and going down to metabolic and endocrine disorders. All these disorders, the main idea is to know the nursing management of patients who suffer from disorders affecting each of these systems. I'll be taking management of patients with endocrine system disorders. But before we go in to talk about the endocrine disorders, let's review briefly overview of the anatomy and physiology of the endocrine disorders. As we all know, the endocrine disorder play a vital role in various folios like growth and development, metabolism of energy, muscles and adipose tissue distribution, sexual development, fluid and electrolyte balance, and inflammation and immune responses. And that is why the disorders are manifested by either there is irregularity in the growth and development, in the metabolism of energy, you find them very weak, muscle and adipose tissue distribution, you either see them overweight or underweight, famished, sexual development, disorders ranging from infertility, then we have fluid and electrolyte imbalance, inflammation, and immune responses. Disorders, as I have said from beginning, it ranges from hyperfunction or hypofunction of any of these endocrine disorders. We have this endocrine, the disorders are common and manifested as hyperfunction and hypofunction of any of these endocrine glands. We have so many of the endocrine glands going from the head down to the gonads. In the head, we have the pineal body, can go from the hypothalamus, which is the master gland, divided into the pituitary gland. We have the hypophysis, adenohypophysis, the adenohypophysis, which is the anterior pituitary gland, the neurohypophysis, which is the posterior pituitary gland. We have the thyroid gland, parathyroid gland, which are the side. Then we have the thymus gland, the chest. We have the adrenal gland, adrenal, that is on top of the kidney. Ad on top, then renal, the kidneys. Then we have the pancreatic islets, that is the islets of Langerhans, which are on the pancreas. Then we have the ovaries in females. Then we have the testes in males. So these are how the glands are distributed in the body. And apart from that, we also have the endocrine glands. They usually consist of group of secretory cells. And this group of secretory cells, they are surrounded by an extensive network of capillaries, which facilitate diffusion of these hormones. When these hormones are distributed, it is these secretory cells that help to facilitate the diffusion of these hormones. That is the chemical messengers. These hormones, they are like the chemical messengers, and that is the unit of the whole endocrine system. So they are commonly referred to as ductless glands. Endocrine glands are usually ductless. They don't have ducts, and that is why they have any gland that will have secretory cells. They don't have ducts, because the hormones, they are secreted and they diffuse directly into the bloodstream. So after the hormones are secreted, the bloodstream is the transporter which transports this hormone to their target cells where they act. So it also involves the release of chemical substance, and these hormones are usually also produced by other tissues. We have the gastrointestinal mucosa. They produce hormones like gastrin, enterogastrone, secretin, cholecystectin, that is CCK. Then, and these elements, they are very important in the digestive process. They help in the digestion of food. Then the kidneys, they also produce hormones like erythropoietin, and we all know the function of erythropoietin. They are the one that stimulates the bone marrow to produce red blood cells. Then we have white blood cells, which produce cytokines. And we know white blood cells, when you talk about white blood cells, you're talking about immunity. And they are hormone-like proteins, and they actively participate in inflammatory and immune response, these cytokines. And this immune system and nervous system, they have unique relationship with the endocrine system. Once there's problem with the immune system or the nervous system, definitely the endocrine system will also be affected, because they work hand in hand. These chemicals, they are also known as neurotransmitters. What are examples of this? We have epinephrine, and epinephrine is also released by nervous system, and it can also be released by the endocrine system. They can function as a chemical messenger, and they can also function as a hormone. And we also have the immune system. For example, the cytokines I told you. These cytokines, they actively participate in inflammatory and immune response. And they are also subject to regulation by the adrenal corticosteroid hormones. So the glands I told you, we also have how the regulation of these hormones. We have what we call the positive feedback mechanism, and we have the negative feedback mechanism. These hormones, we've been saying from the beginning, hormones, they help to regulate organ function, composed of several glands. I've mentioned the pituitary gland, the thyroid gland, the parathyroid gland, the adrenal gland, pancreatic islets, ovaries in females, testes in males. And this dual regulatory system, unlike the endocrine, the endocrine system, we also have the exocrine system. And the exocrine glands, most hormones secreted from the endocrine, they are released. But the exocrine glands, example of exocrine glands, we have sweat glands, which secretes their product through ducts. The difference between endocrine glands and exocrine glands, they have ducts, while endocrine glands, they are ductless. In the exocrine glands, like the sweat glands, they release their secretion into ducts, while in the endocrine gland, they release directly into the bloodstream, and they are transported to their target cells where they act. So like I said, we have the negative and the positive feedbacks. So the negative feedback is the mechanism for regulating hormone concentration in the bloodstream. That is, when the hormone concentration is reduced, it sends a signal which helps to release this hormone to meet up the demand for the body. And we also have the positive mechanism, which is amplification of the stimulus and increasing release of hormone until a particular process is complete and stimulus ceases. A typical example is the release of oxytocin during labor. Oxytocin is something that is released until the process of labor. Once the process of labor stops, the release of that hormone stops. But most of the functions of the endocrine system are regulated by the negative feedback mechanism. In your lecture notes, which will be soon released, you will see a table consisting major action and sources of selected hormones. Those are the most important ones. And when we are discussing these disorders of this endocrine system, these are the hormones mainly that cause problem. Most of these hormones, you find out that the disorders, they are very rare, but they happen. So how do you manage? And most times it is from misdiagnosis. You don't know that this, because they are rare, we think it can never happen. These are things that can happen. That 1% that we are always feeling cannot happen. You might be the one to receive that patient amongst that 1% that will have this disorder. Hypothalamus. The hypothalamus releasing the hormone it releases is the releasing and inhibiting hormone. Example of releasing hormone, we have corticotropin releasing hormone, we have thyrotropin releasing hormone, we have growth hormone releasing hormone, then we have gonadotropin releasing hormone. Then it also releases inhibiting hormone. This releasing hormone, they go like the growth hormone, it goes to where the growth hormone will be secreted, that is the anterior pituitary gland, stimulate the anterior pituitary gland to release growth hormone. So then we have the anterior pituitary gland. The hormones secreted there, we have the growth hormone, and we all know the function of growth hormone. It stimulates growth of bone and muscles, promotes protein synthesis and fat metabolism, decreases carbohydrate metabolism. Then we have adrenocorticotropic hormone, which stimulates synthesis and secretion of adrenal cortical hormone. Then we have thyroid stimulating hormone. Thyroid stimulating hormone. It stimulates synthesis and secretion of what? From the name, thyroid stimulating hormone. That is the thyroid hormone. Then we have the luteinizing hormone. It has different function in male and in female. In male, it stimulates sperm production. In male, it stimulates secretion of testosterone, development of interstitial tissue of the testis. Then in female, it stimulates development of the corpus luteum, release of oocytes, and production of estrogen and progesterone. And that is why even in the menstrual cycle, you find out in the graph, you see that where there is a surge of luteinizing hormone, you see that the follicle stimulating hormone, the level of follicle stimulating hormone will depreciate. It cannot rise at the same time. One has to come down for the other to go up. Then we have the follicle stimulating hormone. In female, it stimulates the growth of ovarian follicle and ovulation. It is the one that is responsible for ovulation in female. Then in male, it stimulates sperm production. So you can see even in the menstrual cycle, after stimulating the growth of ovarian follicle, if there is no sperm to fertilize that, then the next step is for the luteinizing hormone to come in. Okay, follicle stimulating hormone, step aside. Luteinizing hormone, oh yeah, stimulate the production of corpus luteum, and that is how from there it will now degenerate and the cycle continues down. So follicle stimulating hormone, from the name follicle stimulating hormone, the follicles in male is the sperm, the follicle in female is the oocytes. Then we have the prolactin, which usually prepares female breast for breastfeeding. Then going back again, we have the posterior pituitary gland. It releases just two hormones. We have the antidiuretic hormone and we have the oxytocin. The antidiuretic hormone increases water reabsorption by the kidney. When you talk about disorders like diabetes insipidus, that is when you talk about problems with this hormone. Then we have oxytocin, which stimulates contraction of pregnant uterus, milk ejection from breast after childbirth. So you can see how prolactin and oxytocin somehow have one similar thing in common. They stimulate the breast for production of breast milk. Then going down, we have the adrenal. We have, in the adrenal gland, we have the adrenal cortex, we have the adrenal medulla. For the cortex, we have hormones like mineralocorticoid, which are mainly aldosterone. Then we have glucocorticoid, which are mainly cortisol. So the mineralocorticoid increases, they are the one that increase sodium absorption and potassium loss by the kidney. Once they collect sodium, they help the body to release, and they help the kidney to release potassium. Then glucocorticoid, they affect metabolism of all nutrients. They help in the metabolism of all the nutrients that is taken into the body, and they help to regulate blood glucose level, affect growth, and they also have anti-inflammatory action and decrease the effects of stress or glucocorticoid. Most times when there is low level of blood sugar, that is what causes stress. But with this glucocorticoid, it helps to reduce the level of stress. Then we have the adrenal androgens, which are also secreted by the adrenal cortex. Mainly, we have the androstenedione, then we have the dihydroepiandrosterone, and they usually have minimal. These ones, they just act on the androgenic activity, and they are they are the ones that help to convert these names that I've mentioned. The androstenedione, they help to convert the androstenedione to the testosterone. Then we have the adrenal medulla. Apart from the adrenal cortex, we have the adrenal medulla, which secretes the epinephrine and the norepinephrine. And this one, they serve as neurotransmitters for sympathetic nervous system. Then we have the thyroid hormone, thyroid gland, which secretes thyroid hormone. And we know the thyroid hormone is divided into, we have T3 and T4. T3, which is triiodothyronine, and T4, which is thyroxine. And the function of these two hormones is basically increase the metabolic rate, they increase protein and bone turnover, increase responsiveness to catecholamines. And what are these catecholamines? They are the same thing as the epinephrine neurotransmitters. Then they are also necessary for fetal and infant growth and development. Then we have the thyroid C cells. The thyroid gland is divided. We have the follicular cells. These follicular cells are the one that releases this T4 and T3, the triiodothyronine and the thyroxine. Then we have the thyroid C cells, and these thyroid C cells, mainly they produce only calcitonin. And what are calcitonin? Calcitonin helps to lower blood calcium level and phosphate level of the body. Then we have the parathyroid hormone gland, which are beside the thyroid gland. And this parathyroid gland, they release parat hormone, And the function of Paras hormone is to regulate serum calcium in the body. Then we have the pancreatic islet cells, which are the insulin and the glucagon. This insulin, we all know generally the function of insulin is to lower blood glucose by facilitating glucose transport across the cell membranes of muscles, liver, and adipose tissue. It is when most times, for example, in conditions like diabetes mellitus, it is mostly when the insulin are produced but they are not utilized by the body. Diabetes mellitus is a condition that can be caused by two factors: inability of the body to produce this insulin, or inability of the body can produce the insulin but the body refuses to utilize this insulin. So it can either be one of both or it can be both. Then we have glucagon, which increases blood glucose concentration by stimulation of glycogenolysis and glyconeogenesis. Then we have somatostatin. Let me not come and bite my tongue saying these things. This delays intestinal absorption of glucose. Then we have the kidney. The kidney releases mainly, we have the renin, erythropoietin. We also have 1,2,5-dihydroxyvitamin D. And all these, their function for the 1,2,4-dihydroxyvitamin D, stimulate calcium absorption from the intestine. Then for renin, it activates the renin, aldosterone, angiotensin system. That is the function of renin. Then erythropoietin increases red blood cell production. Then we also have the ovaries. The ovaries produces estrogen and progesterone, and the function of estrogen is to affect the development of female sex organs and secondary sex characteristics. Then we have progesterone, influences menstrual cycle, stimulates growth of uterine wall, and maintain pregnancy. Then we have the last but not the least, that is the testis, which produces androgens, mainly testosterone. And the function of testosterone is it affects the development of male sex organ and secondary sex characteristics, and also aid in sperm production in male. So going by all these organs, you can see that they all have a function. And as I have said from the beginning, endocrine disorders are usually manifested as either hyperfunction or hypofunction of any of these glands of this hormone. Either they are secreted too much in the body or they are secreted too little in the body. Then there's also another chart there from your notes. It will show you how from the hypothalamus we have either internal or external stimuli or neurotransmitters. They stimulate the hypothalamus. The hypothalamus goes to stimulate the pituitary gland. And you know, as I said from the beginning, we have pituitary gland that is divided into anterior adenohypophysis and neurohypophysis, which is the posterior. And posterior secretes only antidiuretic hormone and oxytocin. Then anterior pituitary gland is one that secretes most of the hormone: growth hormone, adenocorticotropic hormone, thyroid stimulating hormone, follicle stimulating hormone, and luteinizing hormone. Follicle stimulating hormone and luteinizing hormone are grouped together, are also known as interstitial cell stimulating hormone. Then we have prolactin. So they all have their functions and they work like a cycle. Like I told you, regulation of this hormone can either be positive or negative. Negative, when the hormones are low, they send signal to the hypothalamus, which goes down the cycle again. Positive, when the hormones are already secreted in the required amount, they send a signal to the brain to go to the hypothalamus, to go to the target gland to stop release of that hormone, and that's all. But there are instances, like I've told you, like in labor, there's continuous secretion of this hormone until the process of childbirth is completed. That is release of oxytocin. So from there, you will see I've explained most of these organs. Briefly describe most of them, their blood supply. Next class, we'll talk about assessment of endocrine system, how you assess patients, general assessment of patients with endocrine disorders. That can go from getting our data, which can either be subjective data or objective data, to physical examination. How do you examine these patients with these disorders? Then we go to diagnostic studies of endocrine disorders. How do you diagnose disorders before we go properly to talk about disorders of the endocrine system? picking one gland after the other by the special grace of God. Thank you for listening.